Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about microtomy, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. It will be focused on the fifth subsection of the specialist portfolio called microtomy. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the fifth subsection of the first section: tissue preparation techniques, microtomy. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is principles and practice of microtomy. Candidate needs to have the knowledge and understanding about the principles and practice of microtomy. You could ask the candidate to explain what microtomy is and what is its purpose, how is microtomy performed, what equipment is used during microtomy and how it needs to be set up, to list types of microtomes. When addressing this knowledge requirement, candidates should consider purpose of microtomy, tissue support and tissue rigidity, cooling of blocks, precision cutting, equipment used, controlled section thickness, optimal angle, rough trimming versus sectioning, section flotation and flattening, section mounting, section ergonomic setup, types of microtomes used and so on. The second knowledge requirement is action of a range of microtomes for the production of tissue sections. Candidate needs to have the knowledge and understanding about the action of various microtome types. You could ask the candidate to name the types of microtomes that can be used in histology for tissue sections, to explain how they work, if they can be used on any tissue type, what their pros and cons are and so on. When addressing this knowledge requirement, candidates should consider rotary, sliding, rocking, vibrating, or laser microtomes, SAW, ultramicrotome or cryostat, their actions, or their pros and cons. The third knowledge requirement is hazards associated with microtomes. Candidate needs to have the knowledge and understanding about the hazards associated with microtomy. You could ask the candidate to explain what the hazards associated with microtomy are, how these could be minimized or avoided, what the best way of setting up a microtomy station would be, and so on. When addressing this knowledge requirement, candidates should consider health and safety risks like Sharp's injury or repetitive strain injury, health and safety risks associated with solutions that can be used during microtomy for difficult blocks, ergonomic setup, preventive measures like use of blade guard, break, careful approach, safety measures like COSH, risk assessment and training and so on. The fourth knowledge requirement is principles and practice of section mounting. Candidate needs to have the knowledge and understanding about the principles and practice of section mounting. You could ask the candidate to explain what section mounting is and why it is performed, what the key steps of section mounting are, what mounting media is used in your lab, what the difference is between them, and when would they use each media and why. When addressing this knowledge requirement, candidates should consider the way sections are mounted on the slide, tissue size, section position, types of slides available and when to use them, number of sections on the slide, use of control slides, different mounting media like xylene-based mounting for routine use such as Pertex, water-based mounting media for oil red O like glycergel, specialized mounting media like anti-fade for if to prevent photobleaching and so on. The fifth knowledge requirement is requirement for good quality sections. Candidate needs to have the knowledge and understanding about the requirements of good quality section. You could ask the candidate to explain, why is good quality section important? What are the requirements for a good quality section? What techniques to use to obtain good section? What solutions can be used to help them get a good quality section for difficult blocks? When addressing this knowledge requirement, candidates should consider cutting technique, microtome setup, sharpness and type of the blade, use of reagents to help with problematic blocks, optimal section thickness, presence of artifacts like creases, folds, scores, squash, and how to minimize them, the importance for good quality section, and so on. The sixth knowledge requirement is rationale underpinning the examination of deeper sections. Candidate needs to have the knowledge and understanding about the rationale behind examining deeper sections. You could ask the candidate to explain, what is a deeper section and why would it be requested, what the importance of deeper section might be. When addressing this knowledge requirement, candidates should consider superficial sections that were not deep enough, deeper section to confirm diagnosis, to detect hidden features that might be deeper in the tissue, to assess the whole lesion, to rule out certain conditions, to minimize sampling bias, when the initial finding were ambiguous, to assess severity and extent of disease, to minimize diagnostic error, to expose all margins, and so on. The seventh knowledge requirement is section adhesives and the practical importance of their use. Candidate needs to have the knowledge and understanding about section adhesives and their use. You could ask the candidate to explain what section adhesives are and why they are used. Why are slides with different adhesives important in histology? What type of slides do they use in your lab? When would they use them and why? When addressing this knowledge requirement, candidates should consider types of slides like tomo, adhesive, sticky, charged, and routine, different slide coats or charges like egg albumin, positive charge, saline, gelatin, or lysine, preventing tissue loss, maintaining integrity, ensuring accurate diagnostic results by maintaining intact section, minimizing cross-contamination from one slide to the other by tissue lifting, enable advanced techniques which involve rigorous incubation or washing steps, and so on. The eighth knowledge requirement is the clinical significance and impact for patients of sections cut either too shallow or too deep. Candidate needs to have the knowledge and understanding about the clinical significance of sections cut too shallow or too deep. You could ask the candidate to explain, what could be a clinical significance of section cut too shallow, how could they resolve this, what could be a clinical significance of section cut too deep and how could they resolve this, what would be the impact for patients, and so on. When addressing this knowledge requirement, candidates should consider superficial or shallow sections and the non-diagnostic or inconclusive results, possibility for misdiagnosis, delayed treatment due to need for deeper sections, need for additional procedures, cost and time factors involved, inappropriate or delayed patient management. For sections that are too deep, they should consider tissue loss, introduction of artifacts due to aggressive sectioning or loss of diagnostic value within tissue block, Datix, and damaged laboratory reputation, affected patient management. The ninth knowledge requirement is the maintenance of clinical material for supplementary diagnostic and therapeutic testing. Candidate needs to have the knowledge and understanding about the maintenance of clinical material. You could ask the candidate to explain, why is the proper storage of wax blocks and slides important, to name optimal storage conditions, how they would store and document storage of clinical material in your lab, what the retention period for clinical material is, why is proper storage of clinical material important when it comes to supplementary diagnosis or therapeutic testing, and how to find out where the clinical material is stored. When addressing this knowledge requirement, candidates should consider cold storage, retention period, inventory management, documentation, ethical compliance, regulatory bodies, retrieval method, and so on. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is set up and use microtomes safely, and correctly cut wax, and where relevant, resin sections. Candidates should be able to set up and use microtomes safely and correctly. Does the candidate know what steps to take to set up and use microtomes safely? Do they use safety features of the microtome? Do they know if the microtome is set up correctly? Do they know how to cut wax and resin sections? When addressing this competence requirement, candidate could consider the angle, alignment, section thickness, rough trimming versus sectioning, rocking, break and blade guard, difference between cutting wax and resin sections, and so on. The second competence requirement is adjust your personal workstation in an ergonomic manner. Candidates should be able to adjust their workstation in ergonomic manner. Does the candidate know how to set up their workstation in an ergonomic way? Do they know how to adjust the bench, chair, lighting, and position of relevant equipment? Does the candidate know how to move their body so they do not sustain injury? When addressing this competence requirement, candidate could consider bench height, position of microtome and position of other equipment used during microtomy, ease of reach, body movement, lighting, chair used and so on. The third competence requirement is correctly orientate tissues for sectioning. Candidate should be able to orientate tissue for sectioning. Does the candidate know why is tissue orientation for sectioning important? Do they know how to orientate the tissue for sectioning? Do they know the consequences of incorrect tissue orientation for sectioning? Do they know how to correct poorly orientated tissue? When addressing this competence requirement, candidate could consider method used, SOPs, their training and competence, the diagnostic value of correctly orientated tissue, morphological tissue features demonstrated by correct tissue orientation, impact of poor orientation, ways to correct poor orientation and so on. The fourth competence requirement is cut a range of tissue sections to the required standard, maintaining appropriate audit trail records. Candidate should be able to cut various tissue sections and maintain audit trail. Does the candidate routinely cut tissue sections of various tissue types to required standard? Can they use audit trail sectioning? Do they know why the audit trail is important? Do they follow special instructions for microtomy in your lab? Do they know the importance of cutting sections to required standard? When addressing this competence requirement, candidate could consider various tissue types they can cut, number of sections required, section thickness required for this analysis like HNE, IHC, or molecular testing, traceability, tracking systems used in your lab, limb system used, their training and competency, anomaly logs and so on. The fifth competence requirement is follow SOPs for levels, serials, section coils, curls, and step sections appropriately. Candidate should be able to follow SOPs when cutting levels, semi-serials, curls or step sections. Can the candidate cut levels, serials, curls, or step sections appropriately? Do they know when to cut them? Do they understand the difference between them? Do they follow SOPs when cutting them? When addressing this competence requirement, candidate could consider their training, competence, SOPs, and methodology used, various tissue types they can cut these sections from, various sample types and their cutting requirements. The sixth competence requirement is perform basic maintenance and troubleshooting of microtomy equipment. Candidate should be able to do basic microtomy equipment maintenance and troubleshooting. Can the candidate perform maintenance of microtomy equipment? Can they troubleshoot problems with microtomy equipment? Do they know the comments associated with microtomy equipment? Do they keep record trail and documentation when performing maintenance and troubleshooting? Do they perform maintenance on regular basis? Do they follow local methodology for maintenance? When addressing this competence requirement, candidate could consider daily, weekly, monthly and annual maintenance, need for servicing, potential sources of problems with equipment, corrective and preventive actions that can be introduced to prevent problems, record keeping, verification, validation and so on. The seventh competence requirement is evaluate microtomes and blades for routine use. Candidate should be able to evaluate microtomes and blades for routine use. Does the candidate evaluate microtomes for routine use? Do they evaluate microtomy blades for use? Do they know what type of microtome they need to use? Do they know what type of blades they need to use? When addressing this competence requirement, candidate could consider type of microtome used, precision, consistency, ergonomics, safety, ease of use, quality, regular maintenance, sample compatibility, and so on. As for blades, candidate should consider blade style, durability, material, sharpness, compatibility. The eighth competence requirement is troubleshoot problems which may arise, including root cause analysis, as appropriate. Candidate should be able to troubleshoot problems, including root cause analysis. Does the candidate know how to troubleshoot problems associated with microtomy? Are they aware of the common problems associated with microtomy? Can the candidate perform root cause analysis? Does the candidate keep proper record trail and documentation? Does the candidate know how to contact the manufacturer, if needed? When addressing this competence requirement, candidate could consider potential problems like chatter, scores, creases, tissue lifting, thin cutting, not full face, folds, squams, carryover, corrective actions taken, preventive actions, record keeping, verification and validation, ways of contacting manufacturers and so on. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role in context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. You could ask the candidate to complete tables you created, based on knowledge requirements. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific, and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.